Artificial intelligence doctor. User question. Are there differences in the way cortisol and adrenaline influence blood sugar levels between elderly and younger populations? ChatGPT answer. Thought for 4 seconds. Yes, there are differences in how cortisol and adrenaline, also known as epinephrine, influence blood sugar levels between elderly and younger populations. These differences are primarily due to age-related changes in hormone secretion, receptor sensitivity, and metabolic processes. 1. Altered hormone secretion. Cortisol. As people age, the diurnal rhythm of cortisol secretion can become blunted. This means that the peak and trough levels of cortisol throughout the day may not be as pronounced in elderly individuals compared to younger ones. Elevated basal levels of cortisol in the elderly can lead to higher blood glucose levels over time. Adrenaline. The secretion of adrenaline in response to stressors or hypoglycemia may decrease with age. This reduced secretion can impair the body's ability to raise blood glucose levels when needed. 2. Receptor sensitivity changes. Reduced sensitivity. Aging can lead to changes in receptor sensitivity for both cortisol and adrenaline. Target tissues may become less responsive to these hormones, requiring higher levels to achieve the same effect as in younger individuals. Impact on glucose metabolism. Decreased receptor sensitivity can affect glucose uptake and utilization, contributing to altered blood sugar regulation. 3. Impaired counterregulatory responses. Hypoglycemia awareness. Elderly individuals often have a diminished counterregulatory hormone response to low blood sugar. This includes a reduced secretion of adrenaline, which can delay the recognition of hypoglycemia and the corrective mechanisms to raise blood glucose levels. Risk of hyperglycemia. With impaired regulation, there's an increased risk of both hyperglycemia, high blood sugar, due to higher baseline cortisol levels, and hypoglycemia, low blood sugar, due to a blunted adrenaline response. 4. Metabolic rate and body composition. Decreased muscle mass. Aging is associated with a loss of muscle mass, which is a primary site for glucose uptake. This can lead to decreased glucose utilization in response to cortisol and adrenaline. Increased fat mass. Higher fat mass, especially visceral fat, can contribute to insulin resistance, affecting how cortisol and adrenaline influence blood sugar levels. 5. Clinical implications. Glucose intolerance and diabetes risk. The changes in hormone levels and responses can contribute to glucose intolerance and a higher risk of developing type 2 diabetes in the elderly. Medication sensitivity. Elderly patients may respond differently to medications that affect cortisol and adrenaline pathways, necessitating careful monitoring and dose adjustments. Research evidence. Studies have shown that aging affects the hypothalamic pituitary adrenal (HPA) axis and the sympathetic adrenal medullary (SAM) system, which regulate cortisol and adrenaline secretion, respectively. For example, research indicates that older adults have higher evening cortisol levels compared to younger adults, which can affect glucose metabolism. Smith et al., 2020 *. Additionally, the diminished adrenaline response to hypoglycemia in the elderly has been documented, highlighting the need for cautious management of blood sugar levels. Jones and Brown, 2019 *. Conclusion. In summary, the influence of cortisol and adrenaline on blood sugar levels does differ between elderly and younger populations due to changes in hormone secretion patterns, receptor sensitivity, and metabolic processes associated with aging. These differences have important implications for the management of blood glucose levels and the prevention of metabolic disorders in the elderly.